there's a few things that we kind of want to try and put into place. Firstly, that homeopathic medicine is not just a free-for-all. It's been around for a long time. There's a lot of people using it. It's a medical discipline, and it has evolved some, a framework, if you like. It's not just swinging crystals and wiring people up to biofeedback machines or doing weird things. There's also a real structure around the information, and it's based on lawful propositions. It's also based along the idea that living systems can't necessarily be reduced to their parts, and that we're all more of this than the sum of our parts, that the human individual and in fact, every biological entity is moving and reacting and feeling and is memorizing, whether it's memorizing immunologically or psychologically or emotionally, and it is reactive. It is an open system, and yet it is also definable to some extent mechanistically as well. But you can, in one treatment arm, go down a really mechanistic view of people and try and manipulate them back to health, or block receptor sites and try and manage their illness. Or you can, in another situation, try and look at the contexts in which they're unwell, look at the trigger factors that make them sick, look at their reaction patterns, look specifically at their unique ideation, their moods, their response patterns, and actually start to base treatments on the background to illness. Because often if you treat the context for illness well, then the parts look after themselves, they reintegrate, they develop new insights, and they actually start to self-heal. Most of our mechanisms in our body are highly evolved to self-repair, and the question is sometimes why it doesn't develop the insight to resolve inflammation, to prevent bronchospasm, to redress a sensitivity or an allergy. What is it that's preventing self-recovery? Because all the mechanisms and all the systems for self-recovery are there. So it's often a case of looking into the context, looking into the background, the trigger factors and the circumstances in which people are becoming sick. And that means looking outside of the mechanism sometimes, and this non-reductionist approach, this idea that you can use highly individual information that isn't purely diagnostic or purely mechanistic to actually find a route to healing, is another important principle behind homeopathy. Then there's the question around models for illness, and how we model illness is really very complex. You can take a reductionist view or a mechanistic view, and you can look at biochemical pathways, or you can look at gene sequences that appear to predispose to tumours or so on. But you can also understand that a lot of those mechanisms exist within a context, and even though you may have a mechanism of action or a pathogenesis for an illness, different people express that in completely different ways, and that combines with different factors in different people. And in homeopathy, we use quite a few different models for illness that orthodox medicine doesn't use. One of the models we use is the idea that people have a kind of constitutional makeup, that people are so unique and that they develop over time their own vulnerabilities, their own illness pathways, their own compensatory mechanisms and own compensations for illness, and that sometimes tells you what kind of remedy they'll be responsive to. So a constitution is not something we use in orthodox medicine. We don't say, well, he looks that way and he walks that way, I think he'll respond to ibuprofen, or I think he looks like he's going to be a responder to an antihistamine. We don't think that way. We ground the diagnosis and we treat the diagnostic label. But in homeopathic medicine, the way people behave, the way they look, the way they sound, the colour of their skin, the coloration of their, some of their genetic aspects and inherited traits, their behaviour, their choice of words, all sorts of things can build up a picture of an individual that allows us sometimes to pattern recognise treatments for them. So models for illness can be similar to orthodox medicine, or they can be quite different. And I think often in the clinical setting, when you're dealing with a really complex clinical presentation, you're using both. You're using the referral letters, you're using the diagnostic labels, you're looking at the treatment plans that are in place. But very often inside those spaces, people are not doing very well. They've got problems of toxicity, they've got problems with drug intolerance, they're mentally clouded by some of their medications, they've got high levels of background anxiety sometimes, which are almost completely separate entity from the treatable components that relate to their family, their friends, their spiritual awareness or lack of it, or whatever else is going on with them. And those things are things that we understand dynamically, we understand them for the patterns they represent, and that is a route of access into homeopathic treatment.